So Bernie Sanders was doing this interview with MSNBC where he's walking around in Des Moines, Iowa, and he's being asked by this guy from MSNBC, and he actually gives a distinction between himself and Elizabeth Warren. A lot of people believe Elizabeth Warren, and this includes myself, that Elizabeth Warren is the second most progressive candidate in the race, although I think it's more of like a distant second. But he's going to put his foot down here and actually give us a distinction. Let's hear it out.
In my first week in office, we will introduce Medicare for All single-payer program. And in our first year, what we will be able to do is expand Medicare coverage to include dental care, hearing aids, eyeglasses, and home health care. And in the first year of a 4-year transition period, 4 years, we lower the eligibility age for Medicare from 65 to 55. There are millions of people, I suspect, in this community, all over this country, who are so anxious to get into Medicare, and that's what we're going to do. We expand Medicare, we lower it,
Senator Warren
and
also
we lower the
has that
cost
position,
of
though,
health
too,
care.
right?
No, it's Senator Warren's position is a little bit different. Check it out. I think her transition period is quite different than ours.
So that is what he gets into. He kind of tips there at the end. Check it out. Check it out. Her transition period is a little bit different than ours. So obviously I've checked it out before. But basically, the reason why hers is different, okay, Elizabeth Warren's plan is different. It's one of the craziest things I've ever heard in my life, folks. Seriously. So basically what she's going to do is, it says Warren starts by saying she would push a democratically controlled Congress to pass a Medicare public option in the first 100 days of her presidency. The new government insurance plan would immediately cover all children under 18 and every American with an income below 200% of the federal poverty level, about $25,000 for an individual, $51,500 for a family of 4, with no premiums or cost sharing. The uninsured and people eligible for free coverage would be automatically enrolled. There would be an opportunity to opt out. At the same time, Americans over 50 would also be eligible to enroll in the existing Medicare program with new limits on their cost sharing. And so then it says other Americans, including the 160 million people who get insurance through their work, could choose to join the public option if they wish. And it says that. But there's a big catch in her plan. And the catch in her plan is that her plan is not a one-piece bill that is a 4-year transition period over to single-payer healthcare where there's duplicative care is banned. That's not a thing. That's not how her bill works. So get this. What is her idea? She's going to set up this public option, this Medicare public option, which is the vast majority of people on that are going to be poor people. And so if you understand how, a two-tier system works, or you understand how insurance works, the way that insurance works is that obviously, the way premiums are calculated is by, predicted costs, and, how much it gets accepted, etc. is very, conditioned upon the amount that it pays out. And so if you have an entire pile, right, of people who are poor and impoverished on one sort of thing, it's going to be a very bad situation because the payouts are going to be low in terms of how much Medicare is going to reimburse doctors and hospitals and everything. And that's why you have to understand in insurance, it's the healthy young people who subsidize the old people. So the ideal scenario is we have a big risk pool that has everybody in it so that there's this big pool of cash and that we have enough young, healthy people to subsidize the old people who are the ones who are using it more. And then we have like an actual flow going on. That's how car insurance works. That's how any insurance works. That's how insurance works in general. So this is what it says. It says, then by year 3, Warren says she'd take the final step towards single payer and advocate for a bill to eliminate private health insurance. And then it talks about how it would be difficult. This is really hilarious. So again, let me repeat to you folks. She's not passing one bill, guys. She's not passing one bill. She leaves the institution of single payer without private insurance for another bill that she says she'll pursue before the end of her first term. So in year 3, after already fighting your ass off for a public option, which remember how much the Republicans opposed, and even, I believe it was Joe Lieberman who ended up, axing the public option. Remember how much they opposed that. you're going to pass a public option fighting for your life. Then 2 years later, after there's been midterm elections, you're then going to fight for it again. And her idea is like, this premise that you need to convince people in the first place that Medicare for all is going to be good through like this public option that's going to be successful. And again, public option is going to fail, obviously, big time. Because as I explained to you, it's going to be sicked with a bunch of, poor people. So it's not going to be a good insurance plan. And that's the problem when you have this two-tiered system. So that is a very, very bad scenario. And I am glad that Bernie is sort of distinguishing himself from Warren's plan. But I cannot stress to you just how ridiculous Warren's plan is. The idea that you're going to be able to do that, or that it's even a good idea to do that. Like, oh, you're going to pass two landmark healthcare bills in the United States 2 years later, especially after a midterm election. Like, are you kidding me? And also, I don't even think she really supports any of this. I don't think she really supports passing a single-payer Medicare for all system that bans duplicative care. I don't think she's really into that, and I think that's her sort of way of copping out and how she's going to end up not doing it. That's how I think she's going to end up doing this little ploy out of, I couldn't get it.